Welcome everyone to today's webinar. I am Morgan Hafner with Becker's Hospital Review. We are looking forward to today's presentation, Revenue Cycle Top Performers, Financial KPIs, Benchmarks, and Best Practices You Should Be Implementing Now. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. I will now briefly walk through the agenda for today's presentation. Following the introduction, our presenters will discuss a market survey conducted by IngeniousMed. The survey reached more than 100 revenue cycle leaders across hospitals, health systems, and physician groups of different sizes, gathering data on financial challenges for healthcare organizations. Following this, our presenters will highlight key takeaways from the survey results, specifically what it takes to be a top performer. Finally, we will end today's presentation with an audience Q&A. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, throughout today's webinar, we will have several poll questions for the audience. The questions will pop up automatically on your screen. You can then select your answer from the options and click Submit. Thank you in advance for your participation. Today's presenters are Russell Smith and Brian Goebel. Russell Smith is the Chief Portfolio Officer of IngeniousMed. Russell oversees the product management, marketing, professional services, and business development organizations at IngeniousMed. Prior to joining IngeniousMed, Russell served as Senior Vice President, General Manager for Enterprise Information Solutions at McKesson Corporation. Before joining McKesson, he held leadership positions at AT&T and American Express Corporation. Brian Goebel is the Director of Product Management at IngeniousMed. Brian has been with IngeniousMed for the past 9 years and has overseen hundreds of initiatives that have delivered products and services that help IngeniousMed clients improve their operational and financial performance. Brian has 19 years of experience working with software and services companies across a number of different industries, including healthcare, legal, media, and advertising, and government services. At this time, I am pleased to turn the floor over to Russell to begin today's presentation.
Thanks, Morgan, and hello, everyone, and good afternoon. And again, my name is Russell Smith, Chief Portfolio Officer of IngeniousMed. Before we begin, I want to give some background on the company. IngeniousMed provides the leading standalone charge capture and practice analytics that helps the health systems along with physician management organizations, independent hospitals, as well as physician groups to increase their revenues as well as to reduce costs. Our solutions also streamline and simplify some of the clinical workflows while improving the collaboration among some of the care teams. This happens both at the organizational as well as the individual provider level. A couple of key call-outs before we dive into the discussion are that IngeniousMed is, we partner with over 80% of the nation's largest health systems, as well as physician management companies. After conducting 36 independent ROI studies with our clients, we're proud to say that we've produced an average revenue increase of $30,000 per full-time physician. So take that into perspective as we go into our discussions for today. And now I'll hand it over to Brian Goebel, who will walk us through the market survey and some of the key findings.
Thank you, Russell, and thank you to Morgan and for moderating, and Becker's for hosting our webinar today. Tell you a little bit about the survey, give you some background of why we kind of initiated this event. We found that there was very little research being done around the front end of revenue cycle and charge capture in particular. We like to have our finger on the pulse of where the market is and where it's going. Make sure our company is focused on providing solutions to the real challenges out there that you're facing. Some of the things that our goals around this survey is figuring out what it takes to be a top performer, identifying the key performance indicators and benchmarks that you or the market in general is tracking against. Identify what top performers are doing differently than the rest of the pack, and uncover best practices that all organizations should be mindful of and implementing now if you're not already. For this particular survey, it consisted of 40 questions. 104 total respondents were surveyed across the country in a number of different types of organizations. Primarily, about 3/4 of our survey respondents identified as being part of a hospital or health system. Half of them, approximately half of them, were C-suite executives, mostly balanced by the number of physicians in their practices or organizations. And 5 of the 104 respondents were actually Ingenious Med clients. So the bulk of this survey, we wanted this survey to be an independent, true market study of everybody out in the marketplace. So you won't see results here that are skewed by Ingenious Med clients. So as we get into the meat of our presentation today, we'd like to ask you what tools you're currently using as a means to collect your charges. So we'll take about 15 to 30 seconds, and you'll see a multiple choice screen. I think it's open now, where you can indicate the tools and processes you have in play today. As we do that, I'll say, depending on the organization type and revenue cycle strategy, we see a number of different approaches to front end of revenue cycle, each of which offers their own set of benefits and drawbacks. Believe it or not, there are many organizations that still employ charge extraction from physical charts or paper charge cards and super bills that are filled out and turned in by physicians. They're convenient and quick, but susceptible to getting lost. The majority of our hospitals and health systems with EMRs in place have a tendency to employ charge capture via extraction for progress notes, sometimes as a function that's performed manually by a staff of coding resources, sometimes insourced and sometimes outsourced. Some EMRs offer some level of automation around pro-fee charge capture, but still require intervention and reconciliation before claims can be generated. Standalone systems like IM excel at ensuring that all charges are captured and automate the process around reconciliation, sometimes requiring that providers play a bigger part in the revenue cycle process. So let's go through our poll results. And all right. And what we see is a vast majority of you, like our market study, indicate that you guys are using EHR and EMRs as your primary means to manage your charge capture processes. We've got, looks like 9% are using standalone systems, which is good news. 4% are still largely dependent on paper, and 4% are using other means. Our survey results were actually pretty much in line with what you guys just indicated. About 85% of those surveyed use their EHR in some capacity. 28% are using a standalone charge capture solution. So it's good that we have representation for those of you that aren't on the call. And 27% still use paper in some form or fashion. Yeah, the results indicate what many of you would guess, where the majority of our entities surveyed are hospitals. Most organizations are at least relying on, at least partly on their EMR for charge capture. It's rare for any one solution to fit all or any organization's total needs, and more frequently than not, there's a mix of technologies and processes in play. The executives surveyed in this initiative overwhelmingly represented that charge capture is essential to their organization's success. We had 3 takeaways that seemed to fly in the face of this essential nature of charge capture. First was that organizations really aren't talking about charge capture all that frequently. with 42% only talking about it once a month or less. This may mean that what they have in place is good enough, and they're not really aware or experiencing notable revenue losses around their pro-fee service charges. It may also lend itself to the fact that they're consumed with bigger fish to fry, other problems in their organization, which is understandable with the changing landscape around healthcare as a whole, including but not limited to the financial pressures created by, in part, the move to value-based reimbursements. Second finding is, based on the base measure of satisfaction that we use, Net Promoter Score, the survey respondents found that most organizations are unhappy with their current solutions, processes, and performance. Big picture-wise, this isn't too hard to understand. All revenue cycle activity constitutes administrative overhead. And I don't know about any of you, but I'm sure there are very few people that wake up looking forward to tackling administrative tasks. But considering it's an essential component to every organization's financial success, it's amazing that only 10% of respondents would recommend their current tools to someone else. This lack of satisfaction did not really correlate specifically to any one demographic or firmographic data point, which suggests a general dissatisfaction across healthcare, across the healthcare landscape. The third takeaway we had that doesn't quite line up with the essential nature of charge capture is that organizations aren't aware or looking at alternative options, despite the very low satisfaction rates. What's alarming then is that many organizations are not even, what's more alarming is that many organizations are not even aware of standalone charge capture solutions, that there's a better way out there. When presented with a definition of standalone charge capture and asked to name them, the top 3 responses were all EHR systems, not standalone systems. Even when presented with the names of the 6 leading standalone charge capture systems, over half had not heard of any of them. Revenue cycle leaders believe charge capture to be essential, yet they aren't happy with their current solutions, aren't talking about their current processes, and aren't aware that there might be better options out there. To ensure that organizations are getting the most out of their financial systems, leaders should be examining additional options to capture all of the charges they're providing services without leaving any money on the table. While a standalone system might not be right for all organizations, if charge capture truly is essential, researching the benefits and optimized return is imperative. Now let's take a look at where high-performing organizations are living and some of the key performance indicators our survey identified. And we'll see how best performers compared to the rest. We included a number of questions around current performance around revenue cycle activities. Charge lag, which represents how timely charges are entered and the efficiency by which missing charges are identified and mitigated. Bill lag, how long it takes before a charge is sent out as a bill or claim. Average time in accounts receivable. Denial rates and coding accuracy. We've identified top performers in each of these categories as those that qualify in the top 20%. Top performers ensure that their organizations have a charge lag of 24 hours or less. Approximately 33% are doing well on this front. In our experience, there's a direct correlation between a practice's charge lag and the downstream overhead and expenses with revenue recognition. As lag goes up, so do costs and denials, and that's not a good thing for anyone. At IM, our solutions are designed to drive capture of charges as providers see their patients so that those consequences can be avoided. Similarly, top performers have processes to get bills and claims out for reimbursement within 1 to 3 days, which is tremendous. If you're in the bottom of 26%, you're not alone. It's just taking you a little bit more than a week to get those out. Almost all of the organizations asked said that their typical accounts receivable falls within 60 days. The best of the best are at a 14.4%, the best of the best, 14.4% of which have less than 30-day turnaround on AR. Top performers had denial rates under 3%, but there's quite a bit of variance among the total base. And each percentage point carries with it huge financial implications. The best charge capture systems ensure that the charges created are valid and provide error checks at inception, which goes a long way to avoiding denials. Charge and coding accuracy also plays an important role in the optimization of and flow of revenue. Equally, if not more importantly, ensuring accurate charges helps mitigate risks associated with audits for false claims. Though both overcoding and undercoding are considered equally fraudulent, overcoding is obviously the greater of the two concerns, and our top performing respondents ensure that less than 1% of all of their charges require adjustments. Our next poll is going to ask about how you are staffing around charge entry, if at all. Obviously, staffing levels may vary based on your organization's approach to revenue cycle. Some of you have robust departments around coding, billing, and patient accounting activities. Others may outsource some or all of that activity as well, but do your best to estimate the number of people involved in the front end of your coding activities. I will get the poll results. And it looks like about 12% of you indicated that you don't have any coding resources on staff. 31% indicate that you have 1 to 4 coding resources. About 20% say 5 to 9. A little over 10% say 10 to 24, and 26% of you have 25 or more coders on staff. Again, that pretty much directly correlates to our survey results, which indicated that a majority of organizations struggle to find the right balance of using internal and external resources to quickly and efficiently code, follow up, document, and bill for services. Some choose to increase the size of their coding and billing departments. Others choose to outsource. But using our top performers as a benchmark, we can see that having more coders does not necessarily ensure better results. Amongst the top performers, nearly half have 4 fewer employees serving primarily as coders, as opposed to a quarter of you of other organizations. This indicates that throwing horsepower and adding headcount doesn't necessarily equate to better financial results. There can be more significant issues, such as manual workflows and paper processes that must be solved for when looking to streamline your revenue cycle. If you have a process bottleneck where your coding department doesn't get or can't dependably access patient documentation, then adding coders isn't going to necessarily solve your problems. At IM, we think you can improve your performance via our tools and best practices without the need to scale up on back office headcount. When it came time to ask about who is responsible for improvements and better results, the market tends to believe that physicians should own more of the coding responsibility compared to coders, probably due to the fact that they're equipped with the information necessary to ensure the right charge data is collected as services are rendered. But 90% agree that it is a shared responsibility. Coding should be a partnership of some kind between physicians and back office staff. In my experience, providers embrace participation when it's easy and accessible to them. A common sentiment I hear is that they understand why it's important to play a part in coding, but they don't learn coding and billing in medical school. But like I said, I found that when presented with tools that make it easy and accessible for them to participate, they embrace the role. So we talked about coder utilization, but what are the other key metrics that orgs are tracking? Just about everyone identified similar performance indicators, whether you call it days in accounts receivable or discharge not final billed. Those align with denial avoidance. Those, along with denial avoidance, are the things that everyone's measuring. Our findings indicate that little significance between top performers and the rest on these fronts, because regardless of how successful organizations are, everyone is primarily measured by the same things. Having said that, there are significant differences between top performers and the rest when it comes to challenges facing their orgs when it comes to revenue capture. We're going to hear from you again. So we've got another quick poll. Which of the following would you consider to be your most pressing challenges? So missing charges can encompass both leakage and revenue, both the leakage of revenue you think your organization is experiencing, as well as the costs and processes associated with identifying missing charges, like reconciling appointment schedules and daily patient assignments. As we mentioned earlier, some of you may be faced with challenges around timely entering of charges, the integrity of those charges, and the back and forth processes with ensuring that they're accurate and compliant. Others still have challenges because there are different systems in place at different facilities, and coming up with a way to standardize, streamline your revenue capture process is difficult. And if these aren't on your radar, but there are other more pressing challenges, please let us know. Poll results indicate that about 24–25% of you are concerned with missing charges. Another 25% are struggling with coding errors and compliance issues. 20% are both have identified charge lag, and EHR or other technical integrations as a challenge. And that aligns again to our survey results. Unsurprising, but our market findings indicated that identifying and mitigating missing charges was their top challenge overall, followed by a number of categories around efficiency and integrity issues. But when we cross-reference our surveys, top performers versus the rest, missing charges is not as much of an issue. It may seem counterintuitive that the top performers are more worried about charge lag and general inefficiencies and technology challenges than the rest, but they're a little bit ahead of the curve. They've already optimized their processes around charge capture, so they can focus on making small phase 2 improvements instead of front-end issues like charge capture. It makes sense to see non-top performers more concerned about inefficiencies, coding errors, and adoption because they aren't as far along in optimizing their rev cycle processes. As we continue the presentation, if you have any questions, feel free to submit them via the questions dialog in the GoToMeeting controls. We'll take those at the end and do our best to answer them all. If we can't, we will follow up with you following the seminar. Much like the KPIs we identified, when it comes to identified best practices, most organizations say they're implementing the same things. Patient satisfaction aim to drive improved HCAHPS scores or tops of the list. Ensuring that organizations are getting the most out of their resources is a close second. After taking a closer look at the data, the notable differences between top performers and the rest of the field indicated they plan to invest more time improving activities around coding, reviewing rev cycle processes, and driving improved physician performance via process and insights. If we zoom into those 4 categories, we can better see that our top performers are spending more time in those areas. We can infer that these activities are having a greater impact on their rev cycle performance. Again, this comes back to top performers being more advanced in charge capture processes so they can focus more on secondary issues and metrics. So what does this all mean? Quick recap here. Charge capture is essential, but organizations aren't happy with their current solutions. They aren't talking about charge capture processes, and they aren't looking or aware of alternative charge capture options. Top performers are succeeding most in charge lag, bill lag, time and accounts receivable, overcoding, undercoding, and denial rates. More coders doesn't necessarily mean better charge capture. In fact, top performing organizations need fewer coders on average because physicians are taking a more active role in the process. And since they've taken on missing bill issues already, top performers are more concerned with optimizations around integrations, data transparency with physicians, and tracking second-level metrics like physician performance. Top performers also are implementing standalone mobile-enabled charge capture solutions that empower physicians, provide actionable analytics, and automate the charge capture process. For the past 17 years, IngeniousMed has been a trusted partner in helping our client partners in many of these areas via services and solutions that help you optimize your revenue cycle and realize more net revenue around the services you're already providing. We'll take a few minutes to answer any of the questions that were submitted during the webinar. And for those of you that might be too shy to ask, but still have questions, we at IngeniousMed would love to be able to speak with you and see if we can provide you with the answers and solutions you're looking for in order to be successful.
Thank you, Russell and Brian, for that excellent presentation. We will now begin today's question and answer session. Please, if you haven't already, submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. And we have a ton of great questions coming in from the audience today. One audience member is wondering, do you feel that gross AR days do not need to be tracked? If we have a good financial team in place, should we only track net days?
I will say that I do believe it's valuable to track gross AR days, but it's important to track that over time. So you want to be able to have visibility into your organization's financial improvement over time.
Excellent. Thank you for clarifying that question. Another audience member is wondering, what standalone solution do you recommend?
That's a softball. So obviously here at IngeniousMed, we build applications that automate the charge capture process. Again, we're focused on making sure that our clients, their overall revenue recognition process is optimized. We involve providers in the equation. We make it quick and painless for them to enter their charges, manage their patient list, and ensure that they provide quality care to their patients. So yes, please give us a call. If you're looking for a standalone system, IngenioSmed is the one that we recommend above all others.
Excellent. Thanks for that great question and answer. Another audience member is wondering, how does IngenioSmed use these survey results to inform new features and innovation?
So we have a portfolio management process where we kind of take the results, we make sense of what the results indicate. We ensure that our product roadmaps are aligned to the problems and challenges you're facing out in the market, and where necessary, we make adjustments. We make course corrections. Usually these surveys are a starting point for us to take action, to learn more in particular problem spaces. Usually we'll take these survey results and start a campaign to contact our existing clients as well as non-clients or potential clients on any areas that they're looking to make improvements on. And again, we will adjust our roadmap to make sure that we're tackling the right problems.
That's really interesting. Thanks for breaking that down. We have another audience member that's wondering about your solution. Does it work best with one EHR or all of them?
So we integrate with most of the major EHRs. So we support this integration standards, HL7, FHIR. So we offer a number of different solutions to automate the system so that providers aren't looking up their patients, aren't having to manage patient assignments across systems. We ensure that we identify where missing charges exist based on those provider responsibilities, and automate kind of the practice management function.
Great, that's really helpful to understand. And we're just receiving a ton of great feedback from the audience today. And we have another audience member who is wondering, what specialties can IM bills handle?
Our system can be configured to handle all specialties. So specifically around charge capture, we offer the ability to configure electronic super bill templates that can serve the gamut of specialty charge capture needs.
Excellent. And on that same topic of charge capture, in a hospital or network setting, which group do you recommend does a charge capture review process?
So I guess it's a tough question to answer because I'm not quite sure. Are we talking about, or is the question around, should practice managers own the reconciliation process, or is it revenue cycle? Typically, when we go implement, we charge the practice managers to making sure that all charges are entered before the close of business each day. It doesn't mean that they're the only ones that can't take on that function, but in the predominant implementations that we have, that's where that responsibility lies.
Great, thank you for clarifying that. Another audience member is wondering, what teams do you find respond most to training? Is it coders, physicians, charge entry staff, or registration, or all the above?
So we typically don't work with registration staff. Typically, registration will work out of the EMRs or registration systems, but we engage all of the others. And again, it kind of depends on what an organization's needs are. Some small practices, we're only engaging with providers and maybe a practice manager. In some of our larger enterprise clients, we're going top to bottom. So we consult with providers, practice management, revenue cycle personnel from billers, coders, auditors, and even patient financial services. So it just kind of depends on each organization and what the degree of needs are.
Excellent. And the next question is about using outsourced providers. How do charge capture providers interact with end-to-end outsourced providers, such as Conifer Optum 360 or R1 RCM?
Yeah, so all charges that are captured in IngeniousMed are, we can interface them to third-party systems as there. Again, we employ standard HL7 billing interfaces to provide charge and service data. But it's fairly typical in most of our implementations where we will both integrate with the EHR or registration system to automate the creation of patient records in IngeniousMed. After providers have finished their billing activity or charge capture activity for a given day, all of the collected charges are aggregated and sent to those external systems.
Right. That's a really great question, and thanks for that informative answer. Another audience member is wondering, why would an organization that is already using EHR for charge capture implement a standalone solution?
So EHRs are great in a lot of different respects. I think initially they were created as documentation systems. They're a little bit weaker on driving providers to actually do charge entry. They all have the capability to support charge capture, but IngeniousMed's a little bit different. And when a provider looks at their patient assignment list, they can very quickly discern which patients they have created or they've got missing charges against. And as they see those patients, if it's in the inpatient location, they see an aggregate view of all the charges associated with them, including any gaps. We equip practice managers and rev cycle support folks with the ability to also notify providers in the event that there was a change of shift or change of responsibilities over the course of that patient's stay. They can identify which providers were responsible for charge entry. We can deliver notifications to those folks. So the long and the short of it is we are driven to push to make sure that all revenue is realized for a given patient encounter. EHRs, again, they're a great documentation system, great clinical systems. They integrate a lot of data, but they don't necessarily drive physicians to do their charge entry.
Yeah, that's a really interesting perspective. And one audience member would like a little bit more clarification on the survey results. Were the survey results surprising, or did you find that they fit your expectations?
Yeah, I don't think they were shocking, to be honest. I mean, healthcare moves fairly slowly. I will say in the 10 years, almost 10 years that I've been here, the systems in place have evolved quite a bit. Mobile devices have changed the game on a lot of different fronts. So, like I said earlier, charge capture is an administrative task, and providers are busy seeing patients all day. Adding overhead to their workload is not what they're looking for. But we have a founder and still our Chief Medical Information Officer, Steve Liu, who understood the importance of ergonomics and the importance of making it as easy and streamlined for providers to enter their charges. And what you see in our products is a result of the dedication to making it not only effective, but efficient for them.
Great, thank you for that history and breaking that down a little bit further for us. And an audience member is wondering about the database. So who is in the database, and what is the percent of health systems and percent of standalones within that database?
Okay. So it looks like about 26% of our clients are partially standalone, 26% of the survey respondents were partially standalone. 8.6% were standalone only, and of the 104, I'm not sure, but I'll follow up with you.
Great, thank you for that question from the audience member and also for your response. We do have a couple more questions coming in. Which of the best practices do you think is most important to focus on?
Well, I mean, because we are a revenue cycle-minded company, we have a position of, if you're not realizing the revenue that your organization deserves, it's only a matter of time before you're in a bad financial position. Having said that, we understand that there are a whole bunch of other burdens and pressures being placed on the healthcare system around patient satisfaction, value-based medicine, but we start on the revenue cycle side because if you can't keep the lights on, you're not going to be able to worry about those other issues.
Right, exactly. That's a great response. And another audience member is wondering, what should people be looking for in their standalone solutions?
I would say definitely ease of use. Look at the track record of the company that's offering it. I would ask whether they've been able to support different organizations of different size and scale. So, like I said, IngeniousMed has been around for 17, 18 years now. We support some of the top physician management companies and healthcare systems, and we've been doing this for more than a minute. So.
Right, so kind of looking at the history and seeing what kind of organizations they support. Excellent. And another audience member is asking about their specific organization. They say that we still use paper as part of our process because it's so ingrained. So how would you recommend we transition off of it?
Yeah, it's tough to argue with the convenience of paper, especially with providers. When they've got super bills or charge cards, all they have to do is take 5-10 seconds to tick off the services rendered and note the diagnoses that they're treating. The downside is they get lost, right? This happens all the time, and that is an expensive problem. Again, until they're introduced to a charge capture platform that really equates to the simplicity and ease of use that paper is, you're going to have difficulties with adoption. But when coupled with the story and the consequences of lost charges, and usually most of our organizations or some of our organizations, providers are incented based on their productivity. And when their charges get lost, it hits them in the wallet too. So you can make a compelling argument to them on why a better process to ensure that their charges are captured is important.
Absolutely. And we have another audience member who is kind of wondering about their organization as well. They say that it already feels like we don't have enough coders. How can we be expected to do more with less?
So one of the things with Ingenious Med is the providers are playing a huge part in the coding of their charges. We provide guidance and kind of decision support around the codes that they select. We make it easy for them to search for and specify the codes relevant to their practices. So for the clients that have implemented us, they realize the efficiency because the integrity of the charges entered are higher than what you see otherwise. Now, it doesn't absolve an organization from coding activities, but once you have Ingenious Med implemented and you see that there's less adjudication, less editing of charges necessary, you can kind of see where things begin to scale.
Great. Yes, that greater efficiency will definitely play out. And another audience member is wondering, do you advise using a combination of your platform and coders?
Yeah, we can. We support organizations with full-on rev cycle shops. So, one of the components of our system aggregates all charges captured, prevents a platform by which they can be reviewed by physician, by facility, by specialty. It allows revenue cycle organizations to kind of manage work across coders as they need to. But we have other organizations where all of the charges are passed straight through to the billing system. So it just kind of depends.
Great, excellent. And so what is the average in percentage of AR that you're seeing over 90%?
It looks like by the survey results, 3% were over 90 days.
Great. Thank you for that clarification. And it looks like that is all of the audience questions that we've received. Russell and Brian, I want to invite you. Do either of you have any final thoughts that you would like to address before we conclude today's webinar?
I just want to thank everyone for attending and their time. I will remind everyone that as we wrap up here, we'll be sending out the recording of this webinar presentation slides via email to all registrants. We'll also be sending a free copy of our full market survey report in the coming weeks. And in the meantime, if you have questions or want to contact us, ingeniusmed.com/resources has a blog and a set of resources that might be of value to you. If you have any specific questions about Ingenious Med or want to speak to someone directly, please give us a call, send us an email, and we'll get back to you as soon as possible. But thank you again for attending. Be on the lookout in your inboxes for that information.
Excellent. And this brings us to the end of today's program. Thank you to Russell Smith and Brian Goebel for your insights today, and to our audience for participating. Enjoy the rest of your day, and we look forward to having you join us for future webinars.